Are you working in an NABL accredited lab? हाँ साहिल तो है. Yes. और बाकी लोग. चलेगा, अगर नहीं भी है तो कोई बात नहीं.
नहीं है सर. नहीं है सर.
नहीं कोई बात नहीं, ठीक है. इट्स नॉट इजी. हम भी, मैं भी जब एमडी किया मेरा एनएबीएल accredited नहीं था यार. इट वाज नॉट देयर. सो द थिंग इज, व्हाई डू यू नीड टू डू एनएबीएल accreditation? टेस्ट एक्यूरेसी बढ़ता है. मे बी यू डू सर्टेन थिंग्स इन सर्टेन वेज. Accreditation guarantees that test results are more accurate, reliable, and you get the reports in a timely manner if the test is within the scope. Builds trust and compliance, supports continuous improvement, provides an advantage for private labs. So आप मतलब why should anyone invest in accreditation? Basically these are the reasons. It's like a guarantee. So if I have to give you an example, आप जब कपड़ा खरीदते हो, you buy a shirt or something, आप क्या करते हो? You go to a shop, you know a brand, जो आपको पता है, आपको अच्छा लगता है, आप वो लेते हो. Why? Because you know it fits you well. You know what to expect. एक quality का एक guarantee है आपके पास. You may get a similar quality for less on the street. Street side vendors can give you similar quality, but there is no guarantee. It's luck. किसी दिन अच्छा भी कपड़ा मिलेगा, किसी दिन नहीं भी मिलेगा. So similarly, when you're talking of lab results, a lab which is accredited, it is basically giving you an assurance. It is following steps to maintain quality, and आपका जो lab report है वो more or less accurate है, and you can trust it. After accreditation क्या होता है? Lab basically it has to adhere to SOPs, equipments maintain करना है, calibration करना है, ये सब चीजें है. And you have to understand that quality is a continuous process. वो एक time accredited हो गया सब खत्म, ऐसा नहीं है. You have to continue to follow the SOPs and stuff. Right? Also, challenges are the personnel working in the lab may feel there is a lot of documentation. हर एक चीज लिखना पड़ता है. टेम्परेचर का लॉग मेंटेन करो, हाँ, इन्वेंट्री का लॉग मेंटेन करो, ब्रेकडाउन का रजिस्टर मेंटेन करो. A lot of, I mean, documentation which happens, but it is necessary because what happens is you realize that working in a lab is a team effort. It is not a single person's job. So if you don't document it, the other person doesn't know if something has happened or not. Right? Suppose आप बोलो कि नया लॉट आया तो आपका QC चेंज हो गया. हाँ, there is a shift in your QC levels. So is it because of a change in lot, or was there a breakdown in the machine? If it is documented, the other person knows why it has happened or what to expect. Right? Obviously, to reduce the paperwork, most labs have increasingly tried to go the digital way, and you can have all your documents, SOPs on the system. जरूरी नहीं कि हर एक चीज का print out हो. Right? Benefits: patient satisfaction है, reliability of test result है. Staff is also now trained to speak properly with other stakeholders like patients and doctors. ये सब चीजें NABL किसमें आती. At the backbone of all this is quality, and why quality matters. We have seen bits and pieces of this in. Okay, lab NABL को accreditation नहीं है, ठीक है, no problem. So it basically impacts the patient care and safety. That is why quality matters, right? So what are we following these days? NABL का जो medical testing है, it is following the ISO 15189 guidelines of 2022. And it defines requirements for quality and competency in medical labs, and NABL aligns its accreditation accordingly. So behind all these documentation, process, SOP, procedure, log, there's always a purpose. You should never forget that purpose. Okay. In general, if you see the latest guidelines, they are divided into various clauses. 4 is general requirements, where it talks about impartiality, confidentiality. 5 is structural and governance requirements, where it talks about the legal entity of the organization, the role of the lab director, lab's activity, responsibilities, the structure and hierarchy, the HR, the hierarchy, and risk management in general. Clause 6 talks of technical and management system requirements for all disciplines that involves personnel, facilities, environment, equipment calibration and traceability, reagents and consumables, various service agreements. If you're taking any externally provided services, something is getting outsourced, legal documents about that, examination processes, all documentation related to this, control of data, who has access to what kind of data. Everyone would not have access to change data. Like someone would be having, I mean, a senior person or director would probably have the authority to change policy documents, whereas the lab personnel may not have those kind of authority. Control of records, using the most relevant records. That is, you should not be using an outdated SOP because something may have changed in between, and that may lead to errors. So, control of records is important. And evaluations, which also includes audits and all. Then there are certain specific requirements, technical requirements, which they have specified in detail, discipline wise, that you can go through. We'll go through in detail most of these things, right, and why they're important. So before we go ahead, you should know what is quality assurance and what is quality control. Quality assurance basically ensures the system works correctly, and QC, quality control, monitors individual test work, both from the foundation of lab quality and excellence. Right? Quality management system is a document or process which integrates all the processes, documentation, and is necessary for continuous improvement in line with the ISO 15189. So what does accreditation do? You realize that it's not a one-off event, it's a continuous improvement process. It is an ongoing performance. It monitors the performance. There are various steps and checks. There are feedback loops, which helps the personnel identify deficiencies in their procedures and policies, and they improve on it. Patient safety and accuracy are important components of the latest guidelines. So reliable lab results are critical for clinical decisions. Errors can often lead to misdiagnosis or wrong therapy. So one has to be very careful about what kind of reports are being released. Corrective actions, basically labs, once they identify the error or problem, they do RCA, root cause analysis, and take corrective actions wherever possible. So whenever a lab is going for NABL or any kind of accreditation, what do they need? So there is a checklist. So the checklist mostly involves SOPs, records of whatever reports have been released, instrument calibrations, maintenance records, equipment calibration, QC data, if there's been an internal audit, and management review meeting, that is MRM. So all these are important in one of these audit cycles. These need to be completed in each and every audit cycle. Right? Commonly, where there's a shortfall is incomplete documentation. Lack of method validation means there may be a method which you are repurposing it for something else. So you have not validated that method, right? For example, if you are doing HbA1c by immunoturbidimetry, and you can also do HbA1c levels estimation by HPLC or HB electrophoresis. Now, one of your machines is down, and you decide that you will do the HbA1c estimation on your alternative analyzer, which is a different method. If you have not done a method validation, you would not be sure if the difference in values is because of difference in technology, and or is it because of disease progression, right? So for that, whenever you have alternate methods in your lab, you should do instrument comparison, complete method validation, and so that you know that okay, HbA1c value on my autoanalyzer, if it comes say something like 6, in all likelihood it would be somewhere between 6 and 5.5 when I do it on the HPLC. So that kind of method validation is necessary. Poor traceability. So whenever you realize that at the heart of all biochemistry. It's a indirect kind of measurement, right? You're going to compare your values based on the absorbances with known absorbances of standards or calibrators, right? So these standards and calibrators needs to be traceable with something which is acceptable, which is really accurate. So if I have to give you an example, uh, when you say a dimension of 1 foot, the scale ruler has to be calibrated to the international metric system. Similarly, all our standards and calibrators also they have a reference calibrator and standard with which they are traceable. So if you don't have those traceability, you are not sure how good your calibrator is it actually working properly or not. Of course, there are some safeguards in the instrument. If it is too much of the mark, it will not let your uh, assay go ahead. But if there are any problem, I mean, if it is not traceable, then there may be certain challenges. And finally, it is about personnel. So you have machines, you have environment, you have personnel, right? So if the training is not proper or incomplete, a new person is handling the instrument, there are chances that there may be errors, something may go wrong, it may also damage the instrument. So one person, whoever is handling the instrument, they need to be trained properly. There has to be a proper induction, and all of these should be documented. In NABL, these things are documented. It is not just induction; it's not a one-time thing. After induction, you should also, I mean, there are processes where you evaluate the competency of the personnel. So competency assessment is a yearly uh, process, and one needs to actually evaluate, or I mean, structure the competency evaluation in such a way that it really does a proper competency evaluation, right? So there are defined roles in the lab. Everyone is not expected to do everything. So some person who is loading the sample, running the sample, maintaining the machine need not be expected to interpret the results or do a RCA, or may not be adept in analyzing the QC or getting the LJ out. So every person has a different role in the lab based on their experience, their credentials, and their capabilities. They need to be assigned these kind of roles, and you can continue to ensure that they are competent in whatever roles they have been assigned. Then coming to equipment, equipments obviously we are very much dependent on our analyzers. So not just analytical equipment, even the non-analytical parts, like your centrifuges, your weighing scales, your pipettes, everything needs to be calibrated regularly and maintained. So you have options of going ahead with a third party calibration. They will do the calibration, give you a certificate, and it has to be in accordance. So when we talk of calibration of pipettes, basically why is it important? It's important because you realize that most of our QC material or samples, we need to maybe dilute or you need to add some liquid. If your pipette is not calibrated properly and you are reconstituting your QC material, you are thinking that you are reconstituting with an X amount of volume, maybe say 2 ml, 3 ml, 5 ml, whatever. But if it is not calibrated, instead of 5 ml, it may be inaccurate. You would be reconstituting with say 4.5 ml instead of 5 ml. So if you do that, I mean, it is expected that your QC values are not going to be in range. So you're going to be struggling with your QCs because your pipette is not calibrated. So there is importance not only of the analytical instruments, even the non-analytical instruments need to be calibrated regularly, right? Lab errors. So this is something we saw in our previous, what do you say, the last talk. Systematic error and random error. So systematic error can be a trend or a shift, and random error is random as the name suggests. So basically, I'll just quickly go through these things. There's a trend and shift, and there are n number of causes where you can get these kind of errors. And a person who is aware of these possibilities would be quick enough to identify the error, the root cause, and take necessary corrective actions. Right? Yeah. Internal quality control is something which most labs are expected to run on a daily basis. And maybe less frequently for rare parameters. But it is basically to ensure that the lab is confident of the results that they're releasing. External quality assessment is more about accuracy, and it's a comparison of how you are performing with your peers who are using the same method or similar instruments, same platform, and how you are comparing with them. So, like I said, our all our results, reports, QC, everything is a comparison with something or the other, right? So, method validation and verification is necessary because it helps in giving us confidence about the method that we're using, helps with precision or reproducibility, gives us an idea of whether the assay is accurate or less accurate, and also gives us an understanding of linearity. Method validation is something when you are repurposing your one test for something else. Verification is like a lot to lot verification. A new lot has come and you're just comparing the old lot performance with the new lot performance. QCs on the old lot, the QC results you're getting on the old lot may not give you similar results when you're running the same QC on the new lot because there are certain differences, but it should be within range. So then you may expect a shift when there's a lot change, and you should be, if you have done the verification properly, you know how to handle it. Right? Reagents and consumable and QC verification of lot to lot. So not just the reagent, even the QC needs to be verified. Sometimes there's a change in reagent lot as well as change in quality control material lot, and both needs to be verified. The rule of thumb is when you're verifying, you should ideally compare at least two samples across clinical decision ranges, one normal and one abnormal. Right. Then you come to measurement uncertainty. This is something which NABL has asked all most of the NABL accredited labs to do. Basically, it quantifies the range within which the true value lies, and it is required mainly for quantitative results. It basically gives you an idea whether the difference or variation that you're observing in values is it because of is it within acceptable range or not. It is mathematically uh, you can calculate it as it is proportional to the percent CV, and most labs basically use 1.96 or 2 multiplied by percent CV, and that is what MU is, right? Yeah. Yeah. ये fungal growth outside the wall of biochemistry ऐसा वो आएगा HK2 की तरफ से कभी बुलाना है उनको उनको कब बुलाओगे आप वो बोलते हैं, कल दिन में लगा सकते हैं हाँ करो ना whatever necessary they have to do मैं नहीं बाबा कर लो चलेगा yeah sorry. So yeah, you see, these are now structural problems that even we are facing. So ours is we have window AC, we don't have a centralized AC, but there are centralized ACs on the floor above and below. So they have got some fungal growth, and they are taking corrective action right now. Yeah. So, anyways, coming back to where we were, guidance on algorithm for automated selection and reporting. So different labs, as you see, depending on the situation the lab is in, and the workload and personnel that are available, the lab may decide that a section or majority of the results, if they're normal, can just be released without further review. So there are rules that can be set in, and this is an algorithm to help you where it says, okay, the parameter of interest is measured. All the lab policies, that's your QC run, no breakdown, everything is checked. The parameter is within the normal ranges or biological reference intervals. Then it does not require any critical notification. It can be released directly. Whereas if there is a problem, it is an abnormal value, then you have to check for sample integrity, QC, reanalyze the sample, and you do not auto release, do a delta check, and then release. So this is a kind of algorithm many labs follow when they are using uh, automatic release of normal values. So there are guidelines on how a report should be released because it eventually impacts the patient. So NABL has those kind of guidelines where you can release a report without verification and where you cannot. So document and record control is the next section. Proper documentation is necessary and it ensures two, three things: traceability, um, that you are actually using the latest version of documents or SOPs that is needed. And because many times it has happened that, okay, the first version is still being used, somebody says, okay, this is the one, and there are certain variations. And these variations in small, it may be small thing, maybe instead of 10 minutes, you have to wait 15 minutes now for incubation because there's a change. The manufacturer has only said those kind of changes. So if you're using an outdated document, most likely you are going to make some error, and that would lead to again a lot of headache because you have to do RCA, why that error happened, what was the non-conformity, and take necessary corrective actions. So it is important that you are actually updated and you look at the correct documents for reference. Now all results must be traceable. So most of these labs which are NABL accredited, they are using barcodes. There is transfer of data bidirectionally, that is from the barcode to the analyzer to the information management systems. And these also need to be verified at least once in 6 months as per recommendations of NABL. So integration of LIMS, many labs are going towards AI-based QC analytics, middleware, those are softwares. Data analysis is playing a major role in these kind of decision-making algorithms. Organizational structure, as we saw, it is important. Everyone has their defined roles, and everyone need not do the same thing. Management review meetings form an important event in the lab's audit cycle, where whatever challenges the lab personnel face are brought to the attention of the management, and the management is expected to take necessary corrective actions so that the problem does not persist because it can compromise the quality of reports and patient care if it is not taken into account. So corrective action and root cause analysis we have been seeing all through. It is basically the backbone of all this, and the heart of all this is risk assessment, risk mitigation, because not everything carries the same kind of risk. So you realize that certain errors may be occurring too frequently. Certain errors, if it impacts, it may not have a major impact on the patient's outcome, or it may have a major impact on the patient's outcome. For example, a wrongly reported electrolyte value is going to be a serious risk, whereas slightly wrongly reported B12 value or vitamin D value may not carry the same kind of risk that a abnormal electrolyte value carries. Right? So there is a process where you assign a risk score. RPN number is one of the ways you do it, and in NABH they follow a guideline called HERA, where they take into account what is the frequency at which this risk is happening, what is the impact, is it really affecting the patient, is it causing any damage to the patient, and so on. Right. So risk management is important and forms an important aspect of all NABL accreditations. Right? Internal audits are something which is done regularly. It's mainly another person from another lab who comes and audits and looks at all the processes. So a lab basically has policy, processes, and logs or documents. So policy is something which are broad and which gives you a aim and objective, a vision. Processes are a combination of procedures. So procedures are small things. When they are combined in series, it gives you a process. And finally, to document these processes and procedures, you have logs. Right. So if there's a machine breakdown, you have a log for machine breakdown. If there is a failure in temperature, your cold room is not cooling as well, so there is a log where you have to maintain those logs, and then you do the RCA and take corrective actions. Right. So all these form non-conformities, and if there is any deviation from what you are saying, you are supposed to be following as a policy or SOP. They are called considered as NCs, and these NCs are documented. They are again investigated, and corrective and preventive actions are taken. And the key of all this, you realize it's a team effort. So communication and training are critical, and it's a continuous process. So it's not that I am trained once, so I know everything. You have to keep on revising, retraining, depending on the situation. Ethical practices and confidentiality are two new clauses which were introduced in the NABL ISO 15189 2022 document, where there's a lot of focus on patients' data privacy and impartiality in testing. Should not be like, okay, it's my patient, I know this patient, it's a OPD patient, but I know the person working in the lab, so please do it earlier. ऐसा नहीं होना चाहिए idea. That is not fair, isn't it? या फिर आई नो इट्स अ पेशेंट, तो मैं क्या करता हूँ, इट्स अ नॉन वीआईपी पेशेंट, सो आई चेंज द रिएजेंट में नया क्यूसी, नया रिएजेंट, सब कुछ नया करके फिर से कर. तो दैट इज नॉट हाउ प्रॉपर लैब शुड बी वर्किंग, राइट? सो मेन highlights are there is a emphasis on risk based thinking, it is patient centric, and there are steps which the NABL expects the lab to take for continual improvement. This is an important document I thought I should share with you, which most NABL assessors follow when they are doing a assessment. That is NABL 223, and it has a checklist. And what I've done for you is compiled the main points. I'll not go through the details. You can read it at your leisure, and you will realize that if you, it's a nice document to read. You will realize that what are the things assessor expects when a NABL assessment is going on. So, like we saw, there are general requirements. That is, clause number 4 discusses general requirements, with first focus being on impartiality and confidentiality. Over here, you can see there are two columns: one about documentation and second about implementation. So the assessor basically evaluates whether impartiality is being implemented and documented, and so on. So there are many more clauses to come. Uh, Clause 5 deals with structural and governance requirements, like we saw briefly in the beginning. Legal entity. I mean, the lab has to be registered with all the registration bodies. It should have the necessary certificates, the the biomedical waste disposal permissions, and those things. So all those things have to be in place. Then the job description, so 5.2, 5.2.1, and so on, you have all these clauses. So there's no, I'm not going to be discussing all these in detail, but they are all self-explanatory, and you can see that NABL has done an extensive job in trying to make a lab, an accredited lab, follow all these guidelines so that it maintains the requisite quality and standards. Yeah, so 5 is okay. It is more about the legal entity, the HR hierarchy. It has objectives and policies related. I mean, so every lab is expected to define these things. So these are more like policy documents. Then comes resource requirements, where you have it is again divided into personnel, instrumentation, or instruments, and environment. Right. So you have personnel. Again, in personnel, you will have subheadings. There's everything starts with a general clause, and then sub clauses are there. You have competency requirements, like you have, for example, lab shall specify competency requirements for each section, influencing results, lab activities, and so on. So, who does what and what are their capabilities need to be documented and evaluated in a continuing manner. Facilities and environmental conditions, general facility control, is there enough space, storage of hazardous chemicals, storage of temperature sensitive reagents. It should be adequate. There should not be any contamination, and so on. Personnel facilities, equipment requirements, right? 6.4 deals with equipment. Then you have again subheadings related to the equipment. Similarly, you have equipment calibration, maintenance, repair, and so on. Then traceability of measurement of results. So if the equipment is calibrated, there will be a reference to which it can be compared. Right? Then about reagents and consumables. When you're receiving reagents, was it received in proper condition? Was the temperature maintained? You should have acceptance testing. You may find that you took the reagents, but the quality of reagents have deteriorated. So you have to tell your company that, probably proper cold chain was not maintained. You can ask your vendors to give you a certificate for maintenance of cold chain. Reagents and consumables, inventory management, they're critical. I mean, if you're not careful with inventory management, there will be a lot of wastage and you'll incur cost. Right? So it should be recorded properly. What is the lot number? When was it received? What is the expiry date? Is it different from? Is the lot number different from what you had previously? So all these things, the number of boxes, number of kits inside each box, yeah, so on. If you're outsourcing any of your services, if there should be service agreements with whatever kind of service you are being that is being outsourced, and also about POCT, point of care devices. There should be a proper agreement with the POCT operators. So this is what NABL expects in terms of point number 6. So this is the last point, 6.8.3 for point number 6, clause number 6. Then comes the main part, which is about processes, process requirements. This is probably the biggest and the most relevant, where you're looking in detail into pre-analytical, analytical, and post-analytical sections, right? So 7.1 is general, 7.2 is the pre-examination processes, right? Lab information to patients. So it should be displayed properly in two languages, one local and one national, and so on. Primary sample collection, handling, information, how it is to be collected, how it is to be stored, how frequently it is going to be transported. All these details need to be displayed at relevant areas. Instructions for collections, transportation, sample receipt. So it's a very detailed document. It's a nice document to go through. Sample acceptance. When do you reject samples because of wrong tube, wrong volume, wrong time, inappropriate? So all these things are there. And you have 7.3, which mainly deals with examination processes, right? Verification of the method, validation of the method, evaluation of MU. We discussed all these briefly before. And then biological reference intervals and clinical decision limits. So these are all important aspects of the main examination processes, which the lab has to identify and decide what are the, first decide and then follow, right? And then when it's following, it needs to document all the steps that they are following. Ensuring validity of examination results. It is mainly done with IQC. IQC can be a third party or first or second party, or it can also be a patient sample that you are measuring, depending on what parameter it is. Then you have 7.3.7.3 talking about external quality assessment and what you should do. If there is a failure of external quality assessment, and what are the alternatives if there is no EQA program available, you can do lab comparisons and so on. So these are the things that are given, right? Finally, after you have done all that and your results are ready, what your report should contain, what kind of information your report should be giving out, and how you should release a report. If there are any critical values, it should be highlighted. It should be those critical results should be alerted to the clinician, and it should also be documented. And there are different ways by which you do it. In our lab, we do it telephonically. We try to it's easy for the inpatients and often difficult for outpatient samples. We try to identify who is the main primary physician or surgeon, and we try to inform them. And we have a read back policy so that we know that whatever we have said, the person on the other side of the phone has understood it correctly. And we also can say that, okay, the report is ready. You can also check it online. Right. So again, we discussed there are algorithms for automated selection, what can be reported automatically and what should not be reported automatically. There are requirements of reports where patient identifiers, the values, the units, the normal ranges, the method, everything needs to be listed, right? Then what happens when there are certain errors in the reports? You want to modify the report or amend the report, or there is additional information which has come up which you want to add. So there are different rules which are applied here and how you can change or give out the reports which have already been released. Sometimes you will see that the report is see that big labs they do a callback because they suddenly realize that something has gone wrong. Maybe the QC there was a QC failure or there was a run failure, and by mistake a report has been released. So they do a callback and they release a report which supersedes the previous report. Right? Then all this, there's a lot of focus on data privacy. There are systems in place which look into it, and there are also systems in the latest guideline where complaints are taken very seriously. How do you process a complaint, receive a complaint, and resolve a complaint? So all this mainly covers your process requirements of NABL 1518 2022. And the last clause is management system requirements, finally. So basically, it deals with documentation. There is a main quality manual, quality system manual, personal, and everyone does not have access. There is a hierarchy. It's a apex document of the institute, and it tells us about risks, the control of documents, the policies that have been changed, if there are amendments, and those things are documented here. If there are any NCs, corrective actions, records, and all these things related to quality management are documented. Management reviews, audits, and outcomes of these management reviews and audits are also noted. So this basically covers, gives a roadmap how a good lab should work. NABL accredited labs are expected to follow all these things. And if anyone is planning for accreditation and they're not yet accredited, they can go through this document and understand the things they need to set in place before they go ahead for an accreditation. Now, one should realize that accreditation is not a one-time event and it's a continuous process. So how do you maintain? Okay, you enable accredited, but you are not following the things. The next time an assessment is, they're going to get NCs. They may revoke your accreditation. So annual audits, management reviews, they help in maintaining these kind of compliances. So to summarize, NABL accreditation is necessary because it strengthens quality systems, ensures competence, builds trust, focuses on risk-based thinking, emphasizes proactive identification and management of risks. It is a patient-centric approach. Uh, there are certain clauses related to point-of-care devices, and there is also focus on digital transformation and data and LIMS. It enhances requirements for lab information management and data integrity. Right? So with this, I'm happy